Welcome back to Africa 54. July the 11th is World Population Day, and the spotlight is on teen pregnancy. Africa 54 health correspondent Linord Moudou joins us now with more. Welcome, Linord.
Hello, Vincent. Hello, everyone. When speaking of teen pregnancy, well, the story is the numbers. The United Nations says 16 million girls in the world under age 18 give birth each year. More than 3 million girls worldwide undergo unsafe abortions. 19 out of 100 girls in developing countries give birth by age 18, and 3 out of these girls are 15 or younger. So what are the solutions? Well, the UN leaders stress, among other things, the need to get girls into primary school and enable them to receive a good education. Also vital is providing sexual and reproductive health services. Now joining us via Skype from New York City is Sylvia Wong, a specialist on adolescents and youth with the United Nations Population Fund. Ms. Wong, welcome to Africa 54.
Thank you very much.
First of all, to what do you attribute the rising number of teenage pregnancy?
Well, we're seeing that part of it has to do with the fact that we have the largest generation of young people that this world has ever seen. There's 1.8 billion young people, 600 million of which are adolescent girls. 500 million of them are in developing countries. So they're coming of age. They're entering their reproductive health years. So we're seeing a larger number of girls who are entering into reproductive health age, and at the same time, they're not given the adequate information, education, support, or access to services in order to make decisions and choices that could affect their reproductive health.
So are the causes different, or are there some differences to some extent when it comes to developing countries as opposed to the developed world?
There are some differences, but it's important and mindful to know, as you had rightly noted, that 16 million girls globally are giving birth every year, but 95% of these births are happening in low and middle income countries. In addition to that, 90% of these births are are happening in the context of marriage. So when you compare developing countries versus developed countries, we find that one of the biggest drivers of adolescent pregnancy in the world, and especially in developing countries, is child and forced marriage, because these girls are married at an early age, and then once they're married, they're expected to have children right away. So there is that difference between developed and developing countries.
Now,
yet on the other hand,
yes,
across the world and within countries, we're seeing that these girls have common characteristics. They're often the poorest girls, the least educated girls. And so even in a wealthy countries, you will see pockets of these girls who are getting pregnant.
Okay. Now, what are some of the health implications for a young woman who is pregnant as opposed to a woman who is an adult?
Okay. We know that pregnancy complications and childbirth-related complications is the #1 cause of death among adolescent girls ages 15 to 19. And with that, we know that pregnancy for a young woman could be risky as well. So not only is this the leading cause of death for these young girls compared to older women, the implications for their babies and their children are also higher, and to the extent that which we know that for babies and young children, they have a 50% chance of dying earlier than among these girls who are born, among pregnant women who are born, among women who young mothers, compared to women in their 20s or, for example, 29-year-olds. So the health implications are greater for the younger mothers, also for the children.
Okay, Ms. Wong, thank you so much. That's all the time we have for today. Thank you for joining us from New York.
Thank you.
And teen pregnancy knows few boundaries. The U.S. has one of the highest rates in the West. But prevention programs are very effective, as we learn in this report from VOA's Caroline Weaver.
How you doing? Hello. Hi. How you doing? Hi.
These New York City public school students are enrolled in a Children's Aid Society after-school program aimed at cutting teen pregnancy rates.
The egg hasn't been fertilized. By what?
By a sperm.
By a sperm.
Sex education is only part of it. Psychologist Michael Carrera, who founded the program 29 years ago, says effective teen pregnancy prevention efforts must address all a child's needs to help young people envision successful adult lives rather than the dead end of early parenthood.
When young people believe that good things are going to happen in their lives, when they feel that there is promise of success, they reduce risks on their own. So we don't prevent teen pregnancy, they do.
The program features 6 components: sports training and arts workshops, part-time jobs and maintaining individual bank accounts, as well as educational counseling and full medical and dental care, and sex education.
Having a baby at a young age interferes with what kinds of things in your life, okay?
Participants in the Carrera program consistently have 50% fewer pregnancies than other New York teens from similar backgrounds.
To me, the program saved my life. It saved my life.
Felipe Ayala, who now works as the program's college counselor, was one of the first participants in 1984, coming from a tough neighborhood.
The program kept us involved in things and made sure that we weren't looking to have sex, that we weren't in lonely places with young women, or we weren't taking young women and having sex with them and, you know, becoming fathers before we were supposed to.
22-year-old Katie Modesto stayed in through college, getting job coaching and even money for workplace attire. As for sex and relationships, she says, she learned things her parents had not known to teach her.
Even how to say no in certain circumstances. It's very hard sometimes as a woman to say no, because you might like someone, but you're not ready for that step and you think that you should be. And those kind of things, the program definitely made me build confidence, and I'm sure it did it for other girls in the program.
Michael Carrera, now in his mid-70s, says he is still excited to come to work. His program now reaches 4,000 students in 12 states. The Obama White House honored it with a Social Innovation Award, and in 2010 ordered that federal funding for sex education go only to programs of proven effectiveness in reducing teen pregnancy, like the Carrera program. Carolyn Weaver, VOA News, New York.
And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.